We recently published on Hematologica a study where we look at the expression of CD47 and calreticulin in myeloid cancer patient, particularly myelodysplastic syndromes and myeloproliferative disorders. We previously demonstrated that CD47 was overexpressed in some of those patients, and we demonstrated that the expression of calreticulin could be differentiated depending on treatment and depending on treatment response, etc. What we look at was the potential implication of the level of expression up front or during treatment and the response to treatment and the potential outcome. And what we found is that CD47 is not only wrongly regulated at the start, so it's upregulated at disease diagnosis, but in patients that are not responding to treatment, for example in MDS, patients that are not responding to azacitidine, the level of expression of the CD47 is higher. So the antiphagocytic signal that CD47 is given translate into a resistance to some drugs. What we are now trying to also understand is whether some of the previous drug development, such as anti-CD47, anti-SIRP alpha agent, failed in phase 3 trials, probably because it's not just about CD47 deregulation, but it's also about who is going to respond to the regulation of CD47, and I'm thinking about macrophages. So a line of research that we're now conducting in my lab is understanding the damage that macrophages might have also, they might also experience as part of the myeloid disorder, whether the polarization of the macrophages has any implication in not responding to the CD47 or the calreticulin message, and whether there is anything that we can do to repolarize in the right way. And it will take some time to understand, but there are some new drugs that are potentially the benefit of repolarizing macrophages and what we would call now macrophages checkpoint inhibitors, which we never had in pipeline, and there's some interesting data in AML, which we want to also look into MPN.